Oh, yo, what is going on, world? Yo, today is Friday. Today is Friday, y'all. Today is Friday. Y'all already know what the deal is. We are doing NCLEX questions. It's been a long week, y'all. It's been a long week. So, first of all, shout out to everybody that did well on their exit exams, that did well, those HESIs, those ATIs, those people that are getting ready to, take a nice break and get ready to prepare for this NCLEX. Good evening, Miss Jelaine. Good evening, Miss A. Happy Mom, how are you? What's up? What's up? What's up? You guys already know the deal. Hey, I need 100 folks up in here. You take your NCLEX next Friday. That's what I'm talking about. That's what I'm talking about. I already know how y'all already know y'all feel. Y'all feeling good. We looking good. You know what I'm saying? We doing all what we need to do. Hey, but remember, graduation stuff happened this week, right? For a whole bunch of people and some people for next week, right? But you cannot forget that the end goal is to pass that NCLEX. So, hey, enjoy the time with your family. Enjoy this time off. Give yourself a couple days. But, hey, you got to put in that work. All right, y'all already know the deal. We need people smashing that like button. We need shares and we need likes. It says, Kev Breezy just passed my finals. My man, that's what I'm talking about. That's what I'm talking. Hey, congratulations to you. Passed those finals. You know what I'm saying? On to the next. On to the next. All right. Hey, but hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. You guys already know. Hey, I got some good questions for y'all today. I got some good questions. To even include a case study. See, y'all ask and I deliver eventually, right? So, y'all smash the like button. Hey, you already know the deal. 10,000 likes. That's where we're going. If you don't give me 10,000 likes, I promise you, I'm boycotting this whole live stream. All right. So make sure you guys like, share, follow. And if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Jelaine says she's from New Orleans, right? Nolans, girl, I see you. Was it Christina from Texas? Shout out to Texas. What part of Texas? Butterfly said, what we learning? Girl, you know what we learning. NCLEX. That's what we learn every day, all day. All right. Every day, all day. Hey, we got a comprehensive today, right? It's pretty good. You know what I'm saying? It's pretty good. From Brazil, shout out to you. Amarillo. Well, that's all the way in the Panhandle, right? That's Abilene. Now, you already know. You know what I'm saying. It's up there. It's probably real cold up there. It's just like you're from Temple, Texas. Hey, shout out to Temple. Hey, look, your boy. He's from Killeen. I know a little bit about Temple. You know what I'm saying? That's from Ariel. Please, I need help with the NCLEX. Well, that's why you're here, right? That's why you're here, is to get help with the NCLEX, and that's what we're doing. So, also, if you guys want to check those links out that I got up in the bio, you guys can check that out. Got, private, the 7-day NCLEX course. Got a freebie up there. Check that out. You already know how we do this thing, right? So, I'm going to give it a couple more minutes. Hey, we need 100 folks. We need 100 people. I don't know what y'all are doing. I don't know why y'all aren't sharing it. I don't know what we're doing. I only got 3 shares. You know what I'm saying? I need at least, we got to get it to people. Shirts. You want a shirt? Hey, look, I'm working on shirts. Hey, I got you. Carolina says I'm waiting to go to work. Carolina, look, I'm sad. Hey, but congratulations to you, Miss Ma'am, for graduating. Congratulations to you, because you already know the deal. Hey, so we got 50 something people up in here. I guess nobody wants questions today. And it's Friday too. That's a shame. But also, hey, shout out to everybody. I saw somebody say that they were from Canada and all that good jazz. What's going on with this Friday today? What's going on with this Friday? I'm gonna give it a couple of more minutes. I ain't gonna hold out on y'all. You know what I'm saying? Aaliyah, look, girl, I got you. I ain't gonna hold out. You know what I'm saying? Well, we got to get folks up in here. Is it Euphoria? Ain't never seen the show, but shout out to you. From Minneapolis, Minnesota. Okay, all right. Shout out to you. Shout out to you. Hey, so if you guys are new here, welcome. Got these questions off nurseslabs.com. And I pulled them from other places like like UWorld and Archer. I kind of collaborated. It took me a while to kind of pull these together. So I got some good questions up in here. So if we only got 50 people that are willing to rock with it, then hey, I guess that's it. I guess that's all we got. Shout out to Chirac. I'm in Chicago. No disrespect to you. No disrespect to you, Timmy. You know what I'm saying? You graduate in January 8th, right around the corner. Right around the corner. All right. Hey, so what? Well, we got 53 people up in here. I kind of been rocking for about 5 minutes, but you know what? Since y'all are in here rocking, we just gonna go ahead and we're gonna turn this camera around. Because why hold out on y'all if everybody else don't want to be here? You know what I'm saying? So hey, here we go. You already know the deal. We finna do NCLEX questions. I don't know why that went up so high. Give me 1 second. Pretty sure everybody can see that. All right, bring that in, bring that in. That's me. You already know we do these things Mondays, Wednesdays, and Fridays, right? Let me get this timer ready because y'all take forever, you know what I'm saying? So give me a second. Stopwatch. That way it keeps me honest, keeps y'all honest. All right, y'all. All right, y'all. We ready? We ready? We rocking? All right, let's do this. All right, here we go, y'all. Here we go. Question number 1. The nurse witnesses the collapse of a child while at a sporting event. The child is not breathing and has a pulse of 50. The nurse calls emergency services and initiates rescue breathing. After 2 minutes of rescue breaths, the child is still not breathing and is pale with a pulse of 30. Which of the following actions should the nurse take next? So systematically, we have a patient, right? We've done one thing. Now we're going on to the next. What is the next thing that I do? Do I initiate chest compressions, provide rescue breaths for an additional 2 minutes, provide abdominal thrust, or use a finger to check the mouth for a blockage? What are we thinking? What are we thinking? Adam, shout out to you. Wait, what, Adam, what happened? What I miss? Somebody said I graduated. I have a question. What's your question? Hey, you already know the deal. I do an Ask Me Anything after this. You know what I'm saying? I do an Ask Me Anything after this. So if you, whatever questions y'all have and I can't see them and I can't answer them, y'all know the deal. We'll ask them during that point, okay? So I'm going to give y'all another 15 seconds. So what's the answer, y'all? What are y'all thinking? Hey, if you're new here, welcome. We're doing NCLEX questions. Yes, these are both for RNs and LPNs. RNs and LPNs, okay? So I'm going to give you guys a little bit more time. Also, make sure y'all smash that like button. Make sure you guys share. Make sure you guys follow. Get carpal tunnel for me right now. Make it happen. All right, here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is number 1. Infants and children often develop respiratory distress and bradycardia prior to cardiac arrest. Oh my God, I can't read. After witnessing the collapse of a child who is not breathing but has a pulse, the nurse should contact emergency services and begin rescue breathing. Rescue breathing is performed at a rate of 1 breath per every 2 to 3 seconds. If the pulse remains less than or equal to 60 beats per minute, and there are signs of poor perfusion, aka skin pallor, or they're looking pale, the nurse should initiate chest compressions and assess the pulse every 2 minutes. Every 2 minutes, all right? Hey, this is a comprehensive. Hey, remember, when you guys are studying, you need content, you need Q&A, and you need rationales. This is the part that is beautiful right here. Bella, Miss Lady, I am so glad that you were here. I'm so glad that you're here. Hey, me and Bella had a good conversation. Bella, let everybody know what the deal is. Let them know what hey, we're all about transparency. We're all about love, and we're all about community here. So I want you to let them know what's going on. Here we go. Question number 2. The nurse is making room assignments for multiple clients. Which of the following semi-private room assignments would be appropriate? So how can we cohort, right? Like-minded people, like-minded disease processes. Who can go with who, right? A client with a enteritis and a client with chemotherapy-induced nausea and vomiting, a client who has had a bowel resection 1 day ago, and a client with asthma exacerbation, a client with a total hip arthroplasty 2 days ago, and a client with influenza, or a client with an iron deficiency anemia and a client with intractable diarrhea. What are we thinking? What are we thinking? Hello, everyone. I'm being super transparent. I found out a week ago before graduation, I failed my at a point. Okay. Hey, so I'm just shout out to all 106 of y'all. We're doing NCLEX questions. I need for y'all to smash that like button. I need for y'all to share. I need for y'all to follow. Hey, we need 10,000 likes. 10,000 likes. That's where we're heading. That's what I need. Also, I want to know, if you're new here, who are you, where you're from, where you're at in your nursing journey. Out of my league with this one. Hey, that's all right. Hey, remember, I would rather you guess. Also, use the process of elimination. Right? Apply what you know versus applying what you don't know, right? So think about it. Somebody who has chemo-induced nausea and vomiting, like what would they be looking like, right? Somebody with gastroenteritis, what would they be looking like? You got to paint the picture for yourself, all right? Look forward to these lives. Thanks, Kev. You're welcome. That's what I do. Here we go. Here's our answer in 3, 2, and the answer is number 2. When making room assignments, it's important to remember that a client with an active or suspected infection should not be paired with a client who has a fresh surgical wound or someone who is immunocompromised, right? because the barrier to entry with surgical wounds, as well as somebody having an immune compromise who doesn't have an army to fight off an infection, right? A client having an asthma exacerbation does not have an infection and is not at risk for spreading infection to a client who had a recent bowel resection surgery. All right, remember, content, Q&A, rationales. I'm going to be saying that all night long. All right. So shout out to y'all. Here we go. Question number 3. Hopefully everybody can see that. I know that's tiny, so I'm sorry. Caitlin from Kentucky. Shout out to you taking your NCLEX in January. Shout out to you, Miss Caitlin. Here we go. Question number 3. The nurse is talking with a client with major depressive disorder. Which of the following statements by the client would best indicate that the client is not currently at risk for suicide? I lost my, oh my God. Was it imiprine prescription, and I need to refill it. I plan to attend my grandchild's graduation next week. I will sign a no suicide contract at today's appointment. I seem to have a lot more energy since I started therapy. Look, I'm just letting y'all know paradine? Yeah, something like that. I always mess up the words. No shame whatsoever. Hey, but if you guys are new here, welcome. We are doing NCLEX questions. Make sure y'all smash that like button. Make sure you guys share. Make sure you guys follow. Don't be greedy your whole life. Don't be greedy your whole life. Miriam says 2 or 4. Miriam, you got to give me 1. This isn't select all that apply. Give me 1. Got a bunch of people saying 2. Chloe, thank you for the follow. Appreciate you. Miss Chloe. All right. Jenna says 2. Who's that? Bruce Wayne says 4. Afrolicious. No, you did not. Anyways, she says 2. Faith says 2. Okay. More energy makes this more at risk. Okay. All right. Jenna. All right, here we go, y'all. Here's our answer. In 3, 2, and the answer is number 2. Clients receiving treatment for depression and suicidal ideations must be carefully monitored for indications of increased suicidal intent. During a client interview, the nurse should assess access to psychiatric medications, availability to help during a crisis, future plans and goals, home and work environmental risks, overall effect and level of energy, possible access to weapons. Clients who articulate long-term personal goals and family milestones are less likely to attempt death by suicide. All right, so that was number 2. So shout out to everybody that got that question right. We're doing NCLEX questions. Make sure y'all smash that like button, y'all share, and y'all follow. All right, here we go. Hey, so we're going to do something a little bit different, all right? So I have these exhibits. This is where you get that additional stuff, right? And I'm going to show you guys that after I read this question. Here we go. Question number 4. The nurse is caring for a client who had a myocardial infarction 2 days ago. Which of the following actions would be a priority for the nurse to take? All right, so we have an exhibit. We're going to look at that for an additional information. And here it is, that additional information, if everybody can see that, right? So these are the labs that we have. Right. So the labs that we have our sodium. Notice, hey, on NCLEX, you guys, they're going to give you your labs, right? They're going to give them to you, right? Here are the normal ones. And then here are the labs of that individual that came back, right? So look, our sodium is 140, potassium is at 3, magnesium is at 1.8, and our creatinine is at 1.1. Hey, and this is your EKG. This is your ECG. What's up, Miss Kate? Back for fun. I see you out there. All right, so this is what you guys have. Now, going back to the answer or going back to the question, what is the answer? Whoa, bro, that potassium. Hey, that's what I'm saying. So hopefully everybody picked that up. Now, is it potassium? Is it amiodarone? Or administer potassium, administer amiodarone, notify the healthcare provider, or apply the cardiac defibrillator pads? What are we thinking? Ariel says 2. It's between 1 and 3. Well, Matt, you got to give me 1. Shout out to all 250 y'all in here rocking with me. We are doing NCLEX questions. Hey, I need 10,000 likes, y'all. I need 10,000 likes. Ariel says, nah, it's 1. You sure? All right, now. That's why I say you gotta weigh out all the information that's there. Hey, I'm just letting y'all know there are case studies in here. I got some case studies in here. What was the K? The K was 3.0. The K was 3.0. I'm kind of positive it's 1. Hey, make a decision and run with it. All right, make a decision and run with it. All right, y'all. Then the answer is 1. All right, Kyle, I see you. Potassium. All right, here we go, y'all. Here we go. Here's our answer. Let's see what it is. In 3, 2, and the answer is number 1. Right? So it most definitely was the potassium. What is it? In ventricular trigeminy, premature ventricular contractions occur every third heartbeat. Myocardial injury predisposes the client to, ectopy, which increases the client's risk for lethal dysrhythmias. PVCs are caused and or exacerbated by hypoxia, electrolyte imbalances, emotional stress, stimulants, fever, and exercise. The client's morning lab results show hypokalemia, right? Because he had a 3.0 on a scale that's supposed to be 3.5 to 5.0. Therefore, the priority is treatment of the underlying cause of the ectopy by administering prescribed potassium replacement. So shout out to all y'all that got that question right. All right, remember, content, Q&A, rationales. This right here solidifies what you were learning. All right, here we go. Question number 4. Question number 5. I already went on number 4. But hold on. Did I jump one? No, we're good. I'm like, man, what am I doing? Question number 5. The nurse is caring for a client who has a do not resuscitate directive. The client experiences cardiac arrest and the client's child or adult child states, please do whatever you can to save my parent. Which of the following actions should the nurse take? Contact the healthcare provider to confirm the DNR directive, activate the emergency response team and initiate CPR, request the presence of the client's healthcare proxy, or explain the DNR directive to the child or the client's child. What are we thinking? Hey, I'm just letting y'all know I have 100% been in a situation like this, and it is... I'll tell you how the outcome was afterwards. But shout out to everybody smashing that like button. Hey, if you're new here, we are doing NCLEX questions. I pulled them from all over the place. I pulled them from different spots like UWorld, Archer, Kaplan. I pulled them from everywhere. All right. What is 10? That's just how it was written. So DNR, same thing. DNR, do not resuscitate. DNAR, do not attempt resuscitation. Same thing. Don't be trying to jump through the semantics, all right? Don't make it harder than it already is, all right? I'm gonna give y'all 10 more seconds. 10 more seconds. 5, slow code. Really, Jess? Really? All right, y'all. Here we go, y'all. Here we go. Here's our answer in 3, 2. People saying 2 are dumb for A. Hey, you can't say that because some people don't know and they haven't been down this line yet. Some people aren't even in school yet. All right. So you can't say that they're dumb if they don't know and they haven't been exposed to it. All right. So, hey, chill out. I don't want to get nobody no 600 now, but trust and believe me, I will. But the answer is number 4. Advanced directives outline the client's choices for medical care ahead of time. This allows the family and care team to follow the client's wishes at the end of life when the client may be unable to make choices known. All right. Clients can create a do not attempt resuscitation or a do not resuscitate directive instructing that CPR and other life-saving measures may be withheld. With an advanced directive in place, the client's wishes should be followed even if they conflict with the wishes of a loved one. All right. Hey, I have literally seen a DNR get in place and then a nurse not know that the DNR was in place. We started coding them and they were like, yo, he has a DNR. And then we were just like, oh, shit. So then we had to stop. Trust and believe me when I tell you, it's wild. It's wild out here. And I've seen DNRs get pulled and I'm just like, are you kidding me? For somebody who's been intubated like 4 or 5 weeks, like during COVID, like it's crazy out here. Hey, but real quick commercial break. Hey, I got some test taking tips over there at my website. Check out thebootnurse.com/test. You guys can check those out and up here in the link in my bio. You can be sued. 100% you can be sued. Best believe, right? If you go against a DNR, it's a legal piece of documentation. All right, so hey, y'all go over there. Y'all check that out. 42 pages worth of tips over there for y'all free. Y'all go over there and check those out. All right, bootnurse.com/test. All right, it says, Ken says, thank you. We were just talking about this in class and none of us were sure. I got you. Hey, Kenzie, there's nothing wrong with doing that research on your own. Also, you're never wrong with checking your board of nursing because they have all different types of documentation, evidence-based, from evidence-based to everything that you could think of. So you can always revert back there. Here we go. Question number 6. The nurse is caring for assigned clients. The nurse should first assess the client who, has infective endocarditis and has a temperature of 101.5, had a heart transplant 2 months ago and has sustained sinus tachycardia of 110 beats at rest, had a coronary stent placement via the femoral artery 3 hours ago and is reporting severe back pain, or had a coronary artery bypass graft surgery 3 days ago and is reporting swelling of the extremities used for the donor graft. What are we thinking? Shout out to all 500 of y'all in here rocking with me. Hey, we need 10,000 likes. We need 10,000. Hey, get carpal tunnel for me. Get it right now. Make it happen. I appreciate y'all. Hey, I got these questions from all over the place. All over the place. You name it. Like, it took me a couple of days to pull them together because I wanted to come up with some really good questions. Hey, we got some case studies in here too, y'all. We got some case studies in here too. So I appreciate everybody jumping in here. Also, if you're new, I want to know who you are, where you're from, where you're at in your nursing journey. This live is going to take a little bit longer. This live is going to take a little bit longer because we're going to go through the case studies. All right. So, hey, it's not a select all that apply, y'all. It's just one. It's just one answer. Give me one answer. That's it. Can you help with HESI prep? I do HESI preps. I do HESI preps one-on-one, but I do mostly NCLEX right here. All my lives are basically with NCLEX. All right, y'all, here we go in 3, 2, and the answer is 3. Whoever screamed that at me, I appreciate y'all. And the answer is number 3. A client who undergoes percutaneous coronary intervention and intracoronary stent placement using the femoral approach is at risk for bleeding for retroperitoneal hemorrhage. Aspiration of thrombotic drugs before, during, and after PCI can exacerbate potentially life-threatening bleeding from the femoral artery. Hypotension, back pain, flank ecchymosis, hematoma formation, and diminished distal pulses can be early signs of bleeding into the retroperitoneal space and require immediate intervention. All right, that was number 3. Remember, you got to understand what these questions are asking you. All right, you got to understand who's going to die. When you see questions like that, who's going to die if you don't see them first? All right. And this person very well was going to have a very bad day if you didn't see them first. Oh, you good? Nah. You better take that ass over there. Will you be my BSN? Will you have my BS? Oh, we'll have my B. Oh, okay. I'm tracking. I got y'all. Like, what? So shout out to y'all. Shout out to all you graduated with your BSN. Shout out to you. Here we go. Question number 7. The nurse is caring for a client who sustained a fracture of the right tibia and fibula. Which of the following factors would increase the client's risk for delayed bone healing? Is it a BMI of 29.5 kilograms, a family history of osteoporosis, history of peripheral artery disease, or consumes 1 glass of wine per day like the majority of people that are in this chat? Appreciate y'all. Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them from all over the place. I got them from UWorld, Archer, Kaplan, Hearst, you name it. I pulled them all together. And also, I want y'all to smash that like button. Hey, now we're on the road to 20,000 likes. Now we're on the road to 20,000 likes. Yep, just one. Just one. You can only give me one. All right. Make sure you guys share. Make sure you guys follow. All right. Like I said, make sure you guys smash that like button. But I also want to know who you are, where you're from, and where you're at in your nursing journey. Hey, a little known fact about me, if you guys didn't know this, I failed my NCLEX 3 times. 3 times. All right. So, and trust and believe me when I tell you, nobody cares. No one cares. I mean, only have one glass. Jenna, really? Jenna, you probably got a whole bottle and you're just like, I don't got a problem. No, girl, you got a problem. Don't play with me. But, hey, no job will ever care, y'all. No job will ever care how many times you've taken that exam and were unsuccessful. The only thing that you need to do is to get out of your own way, study, put in the work, and pass this exam. You know, hey, if you guys are finding value, smash that like button. Here we go. But the answer is number 3. Bone healing depends on multiple factors, including nutrition, circulation, and age. A client with peripheral arterial disease has decreased perfusion to the extremities due to atherosclerotic changes in the arteries. Without adequate perfusion, the bone is not supplied with the oxygen and nutrients required for healing. Yup, dang, got it wrong. But that's okay if you got it wrong. What do I always say? For all those that are here, it's okay if you got it wrong. Right? You understand why you got it wrong. You learn from it and then you keep it pushing. This is why you need content, Q&A, and you need rationales. All right. That's all I'm saying. All right. Here we go. Question number 8. The nurse is assessing a client who has a pressure injury. All right. Paint the picture. Paint the picture of what you think the pressure injury looks like. OK, the nurse notes a clean, shallow, dark pink bed wound. OK, the nurse documents the pressure injury as what? Stage 1, 2, 3, or 4. It's blurry. I got you. My bad. Sorry. How we looking? Is it clear as mud? Good. I'm glad. All right. What are we thinking? Y'all? What are we thinking? Good. All right. Good. Got to make sure y'all good. All right, y'all. All right, y'all. But yeah, I failed my NCLEX 3 times, y'all. First time, 75 questions. Second time, 265 questions. Third time, 106 questions. And then I passed it during COVID at 60 questions. So I'm telling y'all right now, this is why I like to teach. This is why I like to do this, is because I wish I had something like this. You know what I mean? And I want y'all to fucking be successful out here. Hey, I'm sorry if I say the F word or if I curse. I don't know what to tell you, because once you become a nurse, y'all are gonna be saying it though. It's like the best. It's like the best word ever. Like, I'm not even gonna lie to you. It's all it is an enhancement word. That's it. Here we go. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is number 2. It's number 2. Pressure injuries are caused by long periods of external pressure that compress dermal capillaries and the underlying soft tissue. Friction against the skin and shearing forces can also contribute to pressure injuries. Pressure injuries are staged from 1 to 4 to classify the degree of tissue damage and determine the most appropriate and effective wound treatment. A stage 2 pressure injury involves partial thickness, skin loss, which includes abrasions, blisters, or shallow craters that extend to the dermis. The bed wound is red or pink and may be shiny or dry. All right, maybe shiny or dry. Okay, so there you go. There you go. That's usually a basic care and comfort type of question, right? So understand what your pressure injuries look like. And when you guys take it on your exam as well, they'll probably have a picture. They'll probably have a picture on there as well, okay? So don't fret. They're going to be like, hey, what injury is this? And then you just go on about your day, all right? Don't make it any harder. Hold on 1 second, y'all. Hey, by the way, if you guys see people coming into my chat or these bots coming into my chat trying to sell me nudes, let me know. Because I don't know if they know this, but you can get nudes for free. I said what I said. I'm just kidding. We ain't trying to do all that. Here we go. Question number 9. The nurse is preparing to administer NPH, insulin, and regular insulin to a client who has received the bed tray or the breakfast tray. Which of the following action should the nurse take? Administer the NPH insulin and regular insulin in 2 separate injections. Administer the NPH insulin now and regular insulin after the client has eaten. Administer the NPH and regular insulin in the same syringe, drawing up the NPH first. Or is it administer NPH and regular insulin in the same syringe, draw up the regular insulin first? What are we thinking? What are we thinking? I have a nice little trick for this one, and I'm pretty sure y'all have heard the same thing in school, but I got you. I got you. Hey, shout out to everybody in here rocking with me. Hey, we need 20,000 likes. We need 20,000 likes. Make it happen. Where's Bella at? I know I seen Bella in here. Bella, where you at? Bella, get carpal tunnel for me right now. Get carpal tunnel for me right now, y'all. Hey, I just want to let y'all know, this is a safe space. If y'all got something that y'all want to talk about, and in regards to freaking you passing or failing exams, it's okay. That's why I'm very transparent. I failed my NCLEX, y'all, 3 times. You know how many tests I failed in school? A lot. Does it matter? Hell no. As long as you get out here and you put in the work. What's his blood sugar first? Don, no one asked you that. No one asked you that. You're going to sit there and spend 5 minutes wondering where the blood sugar is when it ain't even in the stem of the question. Don't do that. Don't do it to yourself. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2, and the answer is number 4. The answer is number 4. NPH can be safely administered with short-acting or regular insulin, which is rapid-acting insulins in 1 syringe. To prepare the mixed dose, insert the needle into the NPH vial without inverting the vial or passing the needle into the solution. Inject the amount of air equal to the amount of prescribed insulin. Inject the amount of air equal to the prescribed dose into the regular insulin vial and withdraw the dose, leaving no air bubbles. Draw the prescribed dose of NPH. Any withdrawal of NPH into the syringe will necessitate wasting the entire quantity. Most long-acting, such as like Glargine or Detamir, are not suitable for mixing and typically are packaged in pre-filled injection pens. All right, so this is why you got to read. He said, I read 3 and not 4, and I read 4. Camille, come on. We know better. I've been out of school. Where should I start when I want to take the NCLEX? You could first start you can go to the link in my bio and check out the 7-day NCLEX course. You can start at YouTube. You can check anything else, right? It says, what's better, UWorld or Archer? Jenner, it just depends. I don't like Archer, but other people I don't like UWorld, but other people swear by UWorld, right? UWorld just didn't work for me. Some people like Hearst. Some people like Kaplan. Some people like NCLEX high yield. Some people like Remar. Other people don't, you know. So me, I liked Kaplan. Me, Kevin, I like Kaplan. So it all just depends. I like Archer, right? Just not really a fan of UWorld. But here we go. Question number 10. The nurse is caring for a client who is receiving a transfusion of packed red blood cells through a PICC line. During the transfusion, the client receives a new prescription for IV amphotericin B. It would be most appropriate for the nurse to what? Administer the amphotericin B through an open lumen of the PICC line, insert a peripheral venous access device and administer the amphotericin B, interrupt the transfusion and administer the amphotericin B, or wait 1 hour after the transfusion is complete before administering the amphotericin B. What are we thinking? What are we thinking? This is where, when it comes to the portions of the content, understanding blood and blood components and blood administration. All right. That's all I'm saying. That's all I'm saying. So even if you get this question wrong, now you can kind of know where to go focus. Like, okay, well, let me go remember and see what we talked about when it came to blood components and administration. All right. All right, y'all. But hey, shout out to all, 130 y'all in here rocking with me. We're doing NCLEX questions. I pulled these questions, Jenna, specifically to Jenna. I pulled these questions from all over the place. UWorld, Archer, Kaplan, Hearst. I pulled them from all over the place. I scoured the internet. All right. So that's where I got these questions from. You guys can go and scour the internet yourself to do the same exact thing. All right. But also, if you're new here, I want to know who you are, where you're from, and where you were at in your nursing journey. And if you're not a nurse, what are you doing here rocking with us? All right. But here's our answer, y'all. Here is our answer in 3, 2. And the answer is number 4. Amphotericin B is an antifungal medication used to treat systemic fungal infections. It is commonly associated with severe adverse reaction or adverse effects, including hypotension, fever, chills, and nephrotoxicity. Due to the similarity between the adverse effects of amphotericin B and symptoms of a blood transfusion reaction, the nurse's best action is to complete the blood transfusion and allow 1 hour of observation before initiating amphotericin B. There it is. This enables the nurse to distinguish between transfusion-related reactions and adverse reactions from amphotericin B. So shout out to everybody. Amphotericin is amphotericin. Hey, that's good. I've never heard of that. That's really good. Adriana says, I'm in my first year of pre-nursing prerequisites and your videos are so helpful. I'm so glad that they're helpful. My daughter is 18, doing her prereqs for nursing, before she can apply. Yep. Good for her. Keep the likes coming. Hey, keep those likes coming. Hey, by the way, y'all, I have an ebook. I spent all this time doing all this stuff for y'all. And I was like, man, let me see if I'm going to make an ebook to see if for those people that like to read or sit on their Surface Pro or their iPad or whatever. So I made an ebook. You can go check it out at thebootnurse.com/victory, or you guys can go check it out. That link is also in my bio. It's going for $29. It's over 700 pages, y'all. It has pharmacy. It has so much pharmacology in there. It's ridiculous. It has EKGs in there, EKG interpretation, as well as we talk about management delegations, both for RNs and LPNs. You guys can go over there and check that out as much as you want. Hey, and then any updates I do to it, you get the free updates. So you guys can go over there and check that out. All right, y'all, here we go. Now, here is the monster. All right, here is the monster of stuff. Now, here's our case study. All right, I'm going to need for y'all to be as patient with me as possible. All right. I'm going to need for y'all to be as patient with me as possible because I had to fit all this on here and it's tiny. It's tiny. All right. I know who I'm coming to when I need to take my NCLEX. Michaela, you already know the deal. I got you. All right. So here we go. Hey, so the nurse is caring for a 22-year-old client who has a stab wound. All right. So here are our history and physical. This is what you guys are going to see on your case studies, right? So the client sustained penetrating stab wounds to the neck, right upper thoracic cavity, and right lower abdomen. Client reports sharp chest pain as 10 on a scale of 0 to 10. Okay. Now, neurologically, the client is alert and oriented to person, place, time, and situation as deep tendon reflexes at 2+. Now we talk about skin. The client appears pale. Approximately 2-inch puncture wound to the right upper thoracic cavity covered with an occlusive dressing tape, on 3 sides that is moderately saturated with blood. Crepitus and sucking sounds heard at the upper thoracic wound site. Approximate 1-inch puncture wound to the right lower abdomen covered with an occlusive dressing that has a small amount of blood. I'm telling y'all, this is a lot. Okay, pneumothorax. Hey, start dropping them in there, whatever y'all think, okay? Here we go. Pulmonary, we have vital signs are We have a respiratory rate of 28 with an SpO2 of 85 on room air. Unilateral chest expansion and dyspnea noted. Trachea is deviated to the left. Breath sounds are diminished in the right lung and clear for auscultation on the left lung. Vital signs are pulse of 144, blood pressure of 92 over 60. Cap refill is less or greater than 3 seconds. ECG shows sinus tachycardia, and he has muscle strength of 4 or 5 of all all 4 extremities. All right, here we go. We're going to the next. We're going to question 11. Now that we've painted the picture, now we're going to go. All right, now let's see. All right, now, based off of that, we need to highlight the 5 findings that require further investigation. All right, further investigation. So now we're going to go back. Now we're going to go back to the scenario. Now, what are the 5 most important things that are in this case study that require follow-up? When you guys take your NCLEX, these will be able to be highlighted, but your boy couldn't do that. I couldn't do all that. Y'all asking too much from me. All right. All right. So what are the 5 things? Name the 5 things. All right. Put them all in one line because Savage, if you start to do that, I'm going to be like, I'm going to forget. See, now I only see 3. All right. 4 and 5, tracheal deviation. Okay. I'm going to give y'all like 45 seconds. Just to give people time. Hey, if you guys are new here, welcome. We are doing NCLEX questions. This is a case study. All right. This is what you guys are going to be seeing on your NCLEX. All right. It doesn't matter if you're an RN or an LPN, you will see them. On April 1st, it changed for both. All right. This is what you guys will be seeing. All right. So I need to see what 5 you guys are going to put on there. What are the 5 things? What are the 5 things that you guys are going to put on here that require us to investigate? As in like, oh, I need to take care of this right now. What are we thinking? Hey, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. Hey, 20,000 likes. 20,000 likes. I know y'all are over here answering all these questions. You know what I'm saying? So here we go. All right, y'all. I think I'm giving y'all enough time. Tracheal and SPO 85. Okay. SPO room. Okay. All right. Pale, the sound, the pressure, O2, unilateral chest. Okay. Crepitus. Okay. There we go. Now they're coming in. Now we're coming in. I know y'all are just like, shit, I got to get the answer out. All right, y'all. Here we go. Here is our answer. Here's our answer in 3, 2. And the answer is number 1. It appears pale. We have number 2, which is our respiratory rate of 28 and our SpO2 of 85 on room air. That unilateral chest expansion. Breath sounds are diminished in the right lung, and that pulse at 114 and the blood pressure of 92 over 60. Right? Those are the things. Those are the most important things. He's pale. Why? Circulation. Right? He has a respiratory rate of what? Of 28 because of airway and breathing. Same thing with O2. Unilateral chest because he got stabbed there. Okay, that makes sense. Diminished breath sounds because he got stabbed there. And the pulse of 114 is because he's bleeding. And his blood pressure is because he's bleeding. Right? ABCs. It's as easy as 1, 2, 3. All right. So I'm not going to read that whole thing. We already talked about it. Vital sign, instability, unilateral chest expansion. All right. That's what it is. All right. Here we go. So we're going to go back to the scenario. Okay. So now we're going to go to question number 12. All right. Now, based off of all of that information that we just talked about, right? You need to specify if the finding is consistent with the disease process of a hemothorax or a tension pneumothorax. I know I saw somebody else ask about that earlier. Hey, Gabriella, you can hate it all you want, but this is your reality. Trust and believe me. So if you don't get used to it now, you're going to be complaining later. You're saying, oh my God, I should have fucking studied. Hey, come on now. Hey, if you're scared, go to church. All right. And you can consider this church because you're getting blessed. All right. Now let's make it happen. Here we go. Now, what are we thinking? Now, based off of those findings with tachycardia, hypotension, the subcutaneous emphysema, and unilateral diminished breath sounds, which ones do they fall under? All right. What do we think? So you got to tell me which one. I know it's a lot. All right. So the hypotension for the hemothorax. Okay. The hemo for tachycardia. Okay. Hey, shout out to all 94 of y'all. I knew I was going to lose a bunch of people once we got here. I knew we were going to lose a bunch of people once we got here because this requires a lot of talking and it takes time. So I'm giving y'all all this time. All right. I'm going to give y'all another 30 seconds. Make sure y'all smash that like button. Make sure you guys share. Make sure you guys follow. All right. That is the trifecta that I need in order to get this out to the people that need it. Hey, If you guys are in school right now or have already graduated, I don't know why you haven't shared it with your cohort. All right. Don't be selfish out here. Don't be selfish out here. What we doing? You know what I'm saying? Trying to get nurses. All right, y'all. Here we go. Here we go. Here's our answer. Here's our answer. Let's see. In 3, 2. And here is our answer. Tachycardia, both for hemothorax and tension pneumo. Hypotension for both hemo and tension pneumo. Subcutaneous emphysema, only for the tension pneumo. And the unilateral diminished breath sounds are both for the hemo and the tension pneumothorax. Okay? Oh, it was a multiple. Yes, it was a multiple. You can't just be like, yeah, I'm just going to pick one or the other. It says you can have multiple. All right? It says that you can have multiple. Hey, these are the type of questions that y'all are going to see. You graduate on Wednesday from nursing school. Shout out to you, Jonathan Morales, like Miles Morales. All right? So, hey, be prepared to see these. Be prepared to see these. All right? Now, here we go. Here is our scenario again. RTFQ, you better read it. You best read it. You know what I'm saying? Camille, I got you. All right, here we go. But here we go. Here's our scenario again. And you'll have the whole scenario for your 6 questions. All right. So let's see. Let's go. What was that? Let's see. Question 13. All right, here we go. Here we go. This is our close or our drop down, right? The nurse recognizes that the client is most likely experiencing what? A flailed chest, an air embolism, tension pneumothorax, or an acute respiratory distress syndrome. What are we thinking? What are we thinking? Who is that? Bruce Wayne says tension. Okay. What else are we thinking? What? Oh man, what happened? Here we go. I see it. I saw it, y'all. It's like, Kevin, it's getting fuzzy. I got you, Gabriella. I got you. I got you. I got you. It's not fuzzy no more, guys. I got you. All right, y'all. Here we go. What are we thinking? I'm going to give y'all 15 more seconds. Shout out to everybody that's in here rocking with me. Hey, we're doing NCLEX questions, and this is a case study. I get asked all the time. I wasn't listening when it says case study. Look at you. RTFQ, or I got to find one for you, just Camille, so you can listen to me. All right, y'all. Here we go. Here we go. Here's our answer in 3, 2. And the answer, of course, is a tension pneumothorax, right? An open pneumothorax is caused by an opening in the chest wall, which allows air to enter the pleural space. A tension pneumothorax is a life-threatening emergency that develops as air becomes entrapped into the pleural space, compressing the heart and great vessels and displacing midline structures to the opposite side. Additional signs include unilateral chest wall expansion, diminished breath sounds on one side, and vital sign instability. So you guys already know what the deal is. A lot of times, hey, when I was deployed, we actually got to do chest tubes as corpsmen, and that's where they say you got to get all that positive pressure going into the pleural space out, because you want nothing but negative. You don't want no space in between there. Everything's supposed to be sucked together. All right. So here we go. Shout out to everybody that got that answer right. Now we're back to our scenario. All right. Well, now we're back to our scenario. All right. Love it. Enjoy it. Get used to it. I can't help it. All right. Here we go. Now, based off of our scenario, which of the following interventions does the nurse anticipate next? Do we do a blood transfusion, a chest tube insertion, endotracheal intubation, or arterial blood gas analysis? Crunch, crunch, crunch. Jamie, what you mean? All right. We got number 2. Okay. All right, number 2. Remember, what am I going to do next? I have no idea why it keeps getting blurry like that. That's weird. All right, y'all. I got y'all. Here we go. We got 2. Chest tube. Okay, chest tube. Michaela says chest tube. All right. Shout out to everybody that's in here. Hey, I don't know what's going on with my likes, though. I don't know what's going on with that. I need 20. We're right there. We less than 3,000. We less than 3,000. Airway. Okay, but what about the airway, Jonathan? What about it? ABCs. What about my ABCs? So which one are you picking? I would do 3 first to somewhat stabilize. Chest tube insertion. Sorry if you guys hear my co-host over there. I don't know what he did. Probably beating himself up. All right, y'all. Here we go. Here we go. Airway is a priority. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is number 2. A tension pneumothorax is a life-threatening and requires immediate chest tube placement to decompress the pleural space, right? Promote re-expansion of the compressed lung, relieve compression of the heart and great vessels, and restore hemodynamic stability. Just like that. And you'd be so surprised. That's why I like case studies, is because you already knew the answer. You already knew the answer like 2 questions back. So when you follow the scenario, right, you literally will be able to get the questions right based off the questions that you had before. You see what I'm saying? So shout out to y'all. That's the subcutaneous emphysema equals crunch, crunch, crunch. Snap, crackle, and pop, baby. You already know the deal, Jamie. Here we go. Whoops, let me go back. That's question 15. But let's go back to our scenario, right? Scenario. There it is. Love it. Enjoy it. Now we're going to question 15. Now, the nurse is assisting the client with repositioning in the bed with the chest tube, or when the chest tube becomes dislodged from the client's chest. Which of the following actions should the nurse take first? Right now, let's look at our additional labs, or our additional information, not labs, right? Now let's see what we got. Now here we go. Here's our additional information. Okay, so check that out. Hemoglobin, hematocrit. Look at our normal ranges. Has a hematocrit or a hemoglobin of 10. Has a hematocrit of 30, right? Oh, look at that. We have our diagnosis for our chest x-ray. A chest x-ray reveals accumulation of air in the pleural cavity and tracheal deviation to the left. Findings are consistent with a tension pneumothorax. Look at that, y'all. Look at that. Now, go on here. Chest tube insertion into the right pleural cavity of the fourth intercostal space. Client tolerates the procedure without difficulty. Dressing is clean, dry, and intact. Vital signs. Here are your vital signs right here. 89. Respiratory rate of 18, BP 112/74, and O2 saturation of 94% on 2 liters via nasal cannula. The ECG shows on normal freaking sinus rhythm, right? So there we go. Now let's go back. Now, what are we going to do first? When it becomes dislodged, right? Is it measure the client's PCO2 for pulse ox? Call the rapid response team. Cover the insertion with your palm. With the palm of a gloved hand, or administer supplemental O2. I already see y'all covered that. Jamie, you wild out here. Here we go. I already know y'all already got the answer. So let's see what the answer is in 3, 2. And the answer is number 3. Y'all got it. Sudden removal of the chest tube or of a chest tube can worsen and cause a new pneumothorax. During the planned removal, clients are instructed to inhale and pause just before the chest tube is withdrawn. Then exhale after removal is complete and the site is covered. By pausing respiration while the lungs are inflated, the client is able to increase intrathoracic pressure and prevent air from entering the pleural space. The healthcare provider then closes the insertion site with sutures and applies an occlusive dressing. If the chest tube is accidentally dislodged from the client's chest, the priority is to cover the insertion site to prevent atmospheric air from entering the pleural space. I want to keep all that positive pressure out of that negative space, right? Ideally, a dressing, such as an occlusive or a 3-sided gauze, is placed over the site immediately to prevent a tension pneumothorax. However, if the nurse does not have the immediate access to dressing supplies, the priority is to place your palm of a clean, gloved hand firmly over the site until the dressing can be obtained. I know that was a lot. All right. But we in there. So shout out to all y'all for getting that question right. All right, here we go. Hey, here's our scenario again, y'all. Here's our scenario again. Live it, love it. The nurse will use the glove hand though. Yep, here we go. Question number 16. All right. Now, based off of the scenario, the client's chest tube is reinserted and connected to a new water seal drainage device. Which of the following observations would require follow-up? So what did I see that was incorrect? What did I see that was wrong that I need to fix, right? Is it continuous bubbling in the water seal chamber? 150 mLs of sanguinous drainage 1 hour after chest tube reinsertion? Is it the water level in the water seal chamber rises with inhalation and falls with exhalation? Is it diminished breath sounds on the right side of the chest, or a pleuritic chest pain on deep inspiration? Remember, this is select all that apply. So it could be one, it could be a few, or it could be all of them. 1 and 4. Okay. Shout out to all 78 of y'all. Hey, y'all got me to exactly 20,000 likes. Y'all tired? Y'all don't want no more questions or what? What's the deal? Y'all tired? Hey, so shout out to everybody that's new here. Hey, we are doing NCLEX questions. All right. We are doing NCLEX questions. I scoured the internet and I pulled some. We're doing a case study. I'm giving y'all what y'all want is case studies, right? Because that's what's on the exam. So I had to scour the internet to make that happen. I won't be doing these too often because they take a lot of time. However, at least you guys will be familiar with them and you guys will be able to see them. All right. That's all I care about. Also, if you are new here, I want to know who you are, where you're from, where you're at in your nursing journey. All right. Who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, what you doing here hanging out with us on this Friday evening? All right. Here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is 1 and 2. When caring for a client with a chest tube, the nurse should monitor for continuous bubbling in the water seal chamber, which indicates an air leak. The water seal chamber prevents air from flowing into the client. Intermittent bubbling is expected in the water seal chamber until the pneumothorax is resolved. However, continuous bubbling indicates an air leak. Continuous gentle bubbling is expected in the suction control chamber, which maintains and controls suction to the chest drainage system. The persistence of excess blood, meaning greater than 100 mLs per hour of sanguineous output, in the collection chamber, which indicates possible hemorrhage from the stab wound or a complication of the chest tube insertion. All right. Or you could, i.e. have a lung puncture. So number 1 and number 2, like soda. There you go. Right there you go. Bubbling equals leak. There you go, Jamie. Shout out to you. Shout out to y'all. Ladies and gentlemen, hey, this is the question that I've been getting asked the whole time. Kevin, can you do this? Blah, 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 blah. Bro, check this out. For the fact that everybody is graduating right now, graduation season is here. Hey, y'all can get the 7-day NCLEX course right now for $48. Y'all can get it. That link is right now in my bio. Y'all can go over there and y'all can go get it. Hey, $48 for the next 48 hours. Case studies are very important. Thank you. You are welcome. By the way, I just uploaded pharmacology, basic care and comfort, and physiological adaptations, part of the 7-day NCLEX review inside of the course. Okay, I just uploaded those. So you'll see those 3 sections. Plus you'll see the new generation NCLEX review where I go over 100 questions. Right. But right now, for $48 all the way until Sunday, you guys can get the 7-day NCLEX course. It is at thebootnurse.com/graduation. All right. And you guys can check that link out up here in my bio. All right. So shout out to everybody that graduated. All right. So this is for y'all. So anybody that wanted to get the review or get the course at $48, thank the people that graduated. All right. Here we go. Question number 17. The nurse is triaging clients at the site of a manufacturing plant explosion. Which of the following clients should the nurse ensure is transported to the hospital first? A client who has a laceration on the left lower leg, a client who has an open fracture of the right tibia and an absent right pedal pulse. Is it a client with a partial thickness burn on both of the hands? Or is it a client who has a large open head wound with a GCS score of 3? What are we thinking? What are we thinking? Shout out to all 69 of y'all in here rocking. Hey, I appreciate the likes. Hey, if you guys are new here, we are doing NCLEX questions, both for RNs and LPNs. All right. Remember, you guys got to think about ABCs, level of consciousness. All right. Think about who is going to die, life, limb, eyesight. Who's going to die first if I don't get them to the emergency room? If I don't get them, to the hospital first? What are we thinking? I'm going to give y'all 15 seconds. Also, I want to know who you are, where you're from, where you're at in your nursing journey. If you guys are new here, what are we thinking? What are we thinking? Everybody's telling me 4. Okay. All right. Everybody's telling me 2. Okay. So it's either 2 or 4. This chick is bad to the bone. Well, Miss Chick bad to the bone, I'm going to need for you to make a choice. All right. Bella says I picked 2. All right, Bella, I see you. But triage is different for disaster. Indeed it is. Very much so. Right. 4 would be a black tag. Okay, Jonathan, I see you. Thinking, Jonathan. All right, here we go, y'all. Here we go. Here's our answer. Pender says 2. All right. Haha, 2. All right. Miss Bad to the Bone. I got you. Here we go. Here's our answer in 3, 2. And the answer is 2. Bad to the bone. I'm really glad you made a decision. I'm glad you made a decision. During a mass casualty event, the goal of the nurse is to triage rapidly and provide the greatest good for the greatest number of people. Clients are commonly triaged using a number code system and placed into 4 categories. When prioritizing clients for treatment, emergent needs should be managed first, followed by urgent and then non-urgent. The client with an open fracture and impaired distal perfusion has an emergent need for care as limb loss may occur without rapid intervention. All right. So shout out to y'all for getting that right. Okay. Hey, so those that pick 4, if somebody has a Glasgow coma scale, that means of 3, that means they have a severe neurological trauma, aka they have a blast injury, a gunshot wound, they have brain matter all out of the place, you know what I mean? They have unequal pupils, or they have what we call a blown pupil. That person is gone. That person is gone. So you would literally go to them last after you take care of the people that are emergent and then walk-in wounded, so on and so forth. All right. So shout out to y'all. And here we go. Here's a little diagram of that too. Little diagram. All right. Little detergent with the emergent, the urgent, the non-emergent, and the expectant. Black tags are the expectant. All right. And then depending on where you are, like in the military, we call green, we call them the walking wounded. Urgent, we call them delay. And for emergent, we say that they're immediate, like they need to go now. OK, and it shows you the examples of those right there. So that's just a quick Google search. You guys can search that up and then, see which ones, work for you. But they are relatively the same. Remember, triage is French for sort. All right. Hey, don't say I ain't never give y'all nothing. Hey, if you find a value, smash that like button. Get carpal tunnel for me right now. Here we go. Question number 18. The nurse in the emergency department is assessing pediatric clients. The nurse should suspect child abuse if a 1-year-old has dyspnea and a swollen tongue after eating part of a houseplant. A 2-year-old who has a large hematoma on the forehead after falling out of a chair. That's pretty much my son. A 3-year-old client with a second degree burn on the face after pulling a cup of hot tea off of the table, or a 5-year-old who has 1 new and 2 healing humerus fractures after falling from a tree. What are we thinking? Shout out to all 77 of y'all are rocking with me here on this Friday. All right. So shout out to y'all. All right. Hey, if you guys are new here, welcome. We are doing NCLEX questions, nursing questions for both RNs and licensed practical or depending on where you live, vocational nurses. All right. I just want to know, hey, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. Hey, make sure you guys make sure you guys share, but also make sure you guys follow. I'm kind of cool sometimes. You know what I mean? Kind of cool. You know what I'm saying? We do these every Monday, Wednesday, and Friday at 5:30. Here we go. Here's our answer, y'all. Everybody's telling me 4. Here's our answer in 3, 2. And the answer, of course, is number 4. All right. The nurse should be aware of physical, sexual, and emotional abuse and comply with state mandatory reporting. Signs of abuse include shaking baby syndrome, which is a very real thing, burns in the shape of household items such as iron spatula, cigarettes, scalding liquids, repeated injuries in various stages of healing, burns, bruises, fractures, injury to genitalia, lapse time between injuries and the time when care is sought. So that means if they got an injury 4 or 5 days ago and then you finally decide that you want to bring them in. Inconsistency between the injuries and the caregiver's explanation of said injury. Like somebody trying to say, oh, the baby rolled off the bed when the baby is a month old and they don't have the capability of rolling over. You see what I'm saying? So those are the things as nurses that we have to pay attention to. All right. Taking care of children, elderly, right? And people that have like mental impairments that are even of age. You know what I'm saying? Those are the people that we have to take care of and watch out for when it comes to abuse. Okay. Here we go. Question number 19. Hey, this is a select all that apply, y'all. So I'm going to need to see multiple answers. The nurse is reading comments on a public social media page maintained by a group of nurses. Which of the following social media post by a nurse breaches client confidentiality? It breaks my heart that our client with, paraplegia was so neglected by the family. A private message everyone. I private message everyone a cute story about a sweet client with dementia. The client in room 5 is positive for influenza, so please remember to get your influenza vaccines. Some of the clients have been acting so aggressively lately, but I am grateful to work with such a supportive staff members. Or wash your hands. Well, if you care for the client in room 4, the client's cultures are positive for Clostridium difficile or C. diff, right? Hey, by the way, C. diff is the best thing you'll ever smell in your entire life. No, I'm just playing. That's terrible. What do y'all think? Shout out to all 83 of y'all in here rocking with me and being so patient as to getting us through this, because I'm telling y'all, this is long. This is long stuff that we're doing right here. Hey, but this is what y'all asked for, and I'm giving it to you. This is what you asked for, and your boy's giving it to you. So we got 3-5, 1-3-5, 2-3-5. I'm going to give y'all 10 more seconds. Also, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what you doing here rocking with us? All right, y'all, here we go. 1, 3, and 5. I see that one happening a lot. All right, here we go. Here we go. Here's our answer in 3, 2. And the answer is 1, 2, 3, and 5. Nurses are ethically and legally obligated to prevent breaches of confidentiality when using social media. That includes TikTok, y'all, so y'all better stop playing. Nurses should protect client confidentiality and safeguard any protected health information learned during care. PHI includes the client's name, diagnosis, history, examination results, or treatment, and may be discussed only in a private setting with the staff members who are directly involved in the client's care, to include sharing PHI when referring to the client by diagnosis, nickname, or room number does not protect the client's confidentiality, even if a client is referred to in a general way without using name, non-specific information, can still reveal a client's identity to a third party. Okay? Also, sharing information in private messenger or using social media privacy settings does not protect confidentiality. All right? Shout out to you, AMS, for getting it right. I'm trying to tell y'all, these hospitals, these clinics, they're not playing. They're not playing. People get fired. You get fired for less. All right. You get fired for less. So for option number 2, sharing information in private messaging or messages or using social media privacy setting does not protect the confidentiality. Once PHI has been shared throughout social media, it can be copied or shared again with others and can always be retrieved even after deleted. That's why, when in doubt, don't speak out. Indeed. I'm pretty sure anybody ever heard about that girl that was in Japan who was talking about the little monsters about working when she worked in, I think, the neonatal clinic, or those girls that were in Jacksonville, Florida, that worked at the Naval Hospital there, literally talking about, it was like during a C-section or during some stuff, and they posted on Snapchat, trying to tell y'all, you will never hear from them again. The military threw them into a hole because of their ignorance with social media. So don't do it. Don't do it, especially when it comes to anything with patient privacy, okay? Here we go. Question number 20. The nurse is preparing to insert an indwelling catheter for a male client. So in what order are you going to place these? And unfortunately, with everyone having phones now, you never know who's recording. Facts. That is 100% facts. I have literally been in a room where I was doing a Foley catheter and I had a family member have the camera all up in my face. Literally all up in my face. She's like, I'm just going to record you in case you're doing it wrong. And I'm like, okay. I was like, I'm not doing it wrong, but can you record from over there and not in my face? I was like, because you're kind of in my sterile environment. So if an infection happens, it's going to be because of you, not because of me. And they're just like, and I'm just like, well, I mean, sorry, Susan. So what are we thinking, y'all? What are we thinking? In what order does this go in? What order does it go in? All right, I'm gonna give y'all 60 seconds. I'll give y'all 60 seconds. I know y'all are down there typing, getting carpal tunnel for me. Hey, if you guys are new here, welcome. We're doing NCLEX questions. We're doing, a put it in order. We got 152643, 61524. Okay, all right. So this is both for RNs and LPNs. So shout out to y'all. Hey, make sure you guys keep sharing, smashing that like button, and make sure you guys follow. That is the trifecta that TikTok needs, and that's what I need so I can get out there to more people. All right. All right, 1, 4, 6, 5. You got to use them all. You got to put them all in order, Pinder. Is it Pinder or Pinder? Pandemic? All right, I'm done. No more of that. I'm sorry. All right, y'all. All right, 15 more seconds. 15 more seconds. Gigi says 1, 6, 4, 2, 3, 5. Okay. Okay. We're going to go through it together. Wait, what do you mean no? What do you mean no? 1, 6, 5. Oh, okay. All right. I got you. Okay. 1, 5, 6, 2, 4, 3. Okay, that's what Becky says. No, Bella, I'm about to go. I'm already been on here for too long. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is 1, 5, 2, 6, 4, and 3. So we want to perform hand hygiene and open the urinary catheter kit, apply sterile gloves, and place the fenestrated drape with the shiny side down. Use the non-dominant hand to grasp the penis below then glands. Right? Use the dominant hand to cleanse the meatus with cotton swab or swab stick. Use the dominant hand to insert the catheter until urine return is observed, and then advance the catheter to the tube bifurcation and inflate the balloon. All right. So shout out to everybody that got that right. I'm not about to read all these right here, right? But yay, you guys already know. You guys know the steps. Follow the steps. All right. Obviously, you want to perform hand hygiene first. Don't be nasty and be like, yeah, I'm going to do that in the middle. Now, what sense does that make, sir or ma'am? All right, here we go. Shout out to everybody that got that question right. Hey, and last but not least, I've been getting asked so many questions about doing an NCLEX review for a group of people. Hey, do you do things for a group of people? So on and so forth. 100%. Now I do. So I'm going to do an NCLEX review / group coaching and what I like to call 30 days, a 30-day tour of duty, military aspect, because, your boy's in the military. So for 10 people, we're going to do group coaching. We're going to do group coaching for the NCLEX. We're going to go over how to answer NCLEX style questions, content. I'm going to give you guys, we're going to go through a study schedule. We're going to do freaking trackers. We're going to understand your NCLEX breakdown. We're going to go through that step by step, and we're going to do it for 30 days. Give me 30 days to make you an NCLEX expert of understanding your critical thinking and applying that critical thinking to clinical judgment. If you're interested in that, check out the website, thebootnurse.com/waitlist, right? It's a wait list right now because the 10 people that jump into it, once it's done, it is done. Once it is done, it is done. And we're going to start ASAP after Christmas. Because it's perfect. It's right after Christmas. You're going to be waiting for your authorization to test. By the time we get finished, it's going to be on and popping. We're going to meet once a week for at least an hour. All right. And the price right now the price for it is $397. But for $397, you get the 7-day NCLEX course, which for a lifetime access, you get to be in a community of people that are outside of this, right? You get to be with a community of people that are outside of this. You get immediate contact with me. Like I said, we meet for at least an hour. Notice I said at least an hour, right? We answer all these questions. We do study sessions. We break down questions together, right? We have a schedule, also a tracker. Look, we're going to do a whole bunch. Y'all going to get a whole bunch. You get a whole bunch in there. But go to the wait list, bootnurse.com/waitlist, or you guys can go check it out. That link is in my bio, all right? You guys can go over there and check that out. I'm trying to tell you, it's only there for the first 10 people. After the first 10 people, it's going to be closed, and then I'm going to do it again at a later on. I'm going to do it again later on and sometime in 2024. All right. Is it okay to write it before the holiday? Yeah, you could. I would do it before the holidays if you can, if you most definitely can. But here we go. Question number 21. The nurse has taught a client with end-stage renal disease and hyperkalemia about recommended dietary modifications. Which of the following menu selections by the client would demonstrate a correct understanding of the teaching? So what do we say to the client to where they're just like, yeah, I get it. This is what I'm going to order and this is what I'm going to eat, right? Is it black beans and rice, sliced tomatoes and cantaloupe, grilled chicken breast, white bread and applesauce, hamburger patties, whole wheat bread and carrot sticks, or is it poached salmon, baked potato, and strawberries? What we thinking? Shout out to everybody in here rocking with me. We're doing NCLEX questions. If you guys are new here, welcome. I need for everybody to keep smashing that like button, to share and to follow. Share. Hey, we need 30,000 likes, y'all. It's like we got to 20,000 and people are just like, nah, I'm good. He gonna do all the questions anyway. You know what I'm saying? Hey, don't be greedy out here. Get carpal tunnel for me. Make it happen. I would get carpal tunnel for you. 4 is the correct answer. Okay. Is it La Vie Estabel? All right, what are we thinking? 2Nice75 says 2. Chelsea Cox says 2. I'm sorry, Chelsea. I don't know why I said your last name like that. I feel like that was a little immature. But Chelsea says 2. I'll go for 2, but I don't know. Hey, make it a good decision now is better than a great decision later. Pinder says 4. Chelsea, hey, I'm sorry. I'm working on myself. I promise. No tomatoes, no potatoes, no whole grains. Jamie, you're so smart. I'm so proud of you, Jamie. I'm not saying that in a disrespectful way. I'm just saying I like people that, go a little bit more into depth. Always choose grill. Hey, in the words of the late, great Mark Klimick that I always abide by, he was just like, when in doubt, pick chicken. Or what's the other one when in doubt to pick chicken? All right, y'all. I'm going to let y'all put that answer down there. But here we go. Here's our answer in 3, 2. Hey, by the way, Just because I said chicken does not mean that that answer is correct. We're about to find out. I'm just letting y'all know. In 3, 2, and the answer, yes, it indeed is chicken. Oh my goodness. All right, here we go. Clients with end-stage renal disease are unable to excrete potassium. Therefore, the nurse should teach them to choose foods low in potassium to maintain normal serum potassium levels. Grilled chicken sandwiches on white bread and applesauce are low in potassium. It says, been a nurse since 2003. Tried to give out easy ways to remember these rhymes. Hey, shout out to you. You've been a nurse since 2003? Man, I'm trying to think where I was at in 2003. Jamie, I don't know if you're ready for this. Jamie, I don't know if Mark K is the best. Mark K is my dude. Shout out. When in doubt, pick chicken. Hey, and if you don't got chicken on there, pick fish. I'm just saying. You ready for this, Jamie? Hey, I was in high school in 2003. Oh, all right, there we go. Question number 22. I don't know how you feel about that, Jamie. I'm just saying. We can go back and forth. You know what I mean? Shush. Hey, I'm just letting you know. I was in high school in 2003. You know what I'm saying? So here we go. Question number 22. The nurse and LPN are caring for a client with ulcerative colitis. Right? Which of the following activities would be appropriate for the nurse to assign to the LPN? Select all that apply. Monitor the client's bowel sounds. Remind the client to track their weight daily. Administer a rectal suppository to the client. Obtain the client's vital signs during a blood transfusion. Or discuss the client's dietary modifications with the dietitian. What are we thinking? Remember, LPNs, it is all about what you can and cannot do and what you can and cannot accept. Right? You need to know your scope of practice. That's the biggest thing that separates you from the RN. You can't delegate. RNs can't delegate what they eat, right? LPNs, you know that there are certain things that you can do, but you can't do them if the RN has not done them first. Right? You cannot take unstable patients. I don't care where you work. You can't take unstable patients according to NCLEX, right? I'm just saying. You can't do it. So shout out to everybody in here rocking with me. All right. Hey, make sure you guys keep smashing that like button. Hey, 30,000 likes, y'all. What y'all doing? 30,000 likes. Make sure you guys share. Make sure you guys follow. Also, if you guys are still in school or if you guys are about to start school, share them to the people that are about to start school. Share this live with the people. Hey, come on now. Hey, by the way, I drop NCLEX videos like every day. So make sure you guys go over there and check that out on the channel. Even if you feel like they may be easy. Hey, it's still getting some knowledge in, all right? But here we go, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is 1, 2, 3, and 4, right? Ulcerative colitis is a chronic disease characterized by inflammation and ulcerations in the large intestines and is resulting in abdominal pain, fever, fatigue, and frequent bloody diarrhea. Frequent diarrhea may cause weight loss and electrolyte imbalances. Therefore, the client should be taught to measure daily weights. Clients with UC typically have hyperactive bowel sounds. Blood transfusions may be necessary depending on the severity of the symptoms. The registered nurse cannot delegate tasks requiring clinical judgment, i.e. initial teaching, assessment, planning, and evaluation. However, the licensed practical nurse can reinforce teaching and monitor clinical findings after initial teaching and assessment by the RN, which is options 1 and 2, and administer medications via most routes, right? Including topically via the rectum, aka the suppository, right? And then monitor the client for adverse effects during a blood transfusion after initiation by the RN, right? Which is number 4, all right? Hopefully everybody got that. It said blood didn't specify if it was after 15 minutes or 30. Hey, so here's another thing about select all that apply. And I need all 73 of y'all to hear this. If you don't know, don't pick it. Remember, now, by the good graces of whoever made sense, is that now select all that apply is partial credit. So let's just say you got 3 out of the 4 right. You got 3 out of the 4 right. You got partial points. So even if you didn't pick the one about blood transfusion, now you need to know and go back saying like, hey, can they do blood transfusion? No, they can't initiate it, but they can definitely monitor it after it's already initiated and verified by 2 RNs or an RN and a doctor, right? So if you don't know, don't pick it. That's for user 90, all right? So even if it doesn't specify, and if you decided to go into the weeds like that, don't pick it. You'd still get the other 3 right if those are the ones that you picked, right? Question number 23. The nurse is teaching a client who has a new prescription for risperidone. Which of the following statements by the client would require follow-up? I will contact my healthcare provider if I have a fever or muscle stiffness. I may become shaky and restless when I am agitated. I may sleep more often while taking this medication. I will try to change positions slowly. What are we thinking? You are welcome. Whoa, what are we thinking, y'all? Hannah says 3. Crestina says 2. Crestina Mendoza says 2. Gigi says 2. Okay. Shayla says P. I don't know what P is, but whatever. I'm assuming that you meant 2 or 0, whatever. The Joy of Tumblr says 2. 2. Got you. Caitlin says 2. All right, so everybody's hovering around 2. Lucky Savage says 2. Hey, if you guys are new here, welcome. We're doing NCLEX questions. We got them off all over the place, all over the internet. UWorld, Archer, Hearst, Kaplan, nurseslabs.com. I got them from all over the place. All right, so make sure you guys like, share, follow. We need 30,000 likes. 30,000 likes. By the way, I'm going to do an Ask Me Anything after this too. So you guys will sit here, we'll talk, we'll chit chat, whatever question you guys have. I'll make sure to answer them as much as I possibly can. Here we go. And the answer, of course, is it's not 22, Pender. It's just 2. Just 2. All right. I'm just saying. I know I'm just being difficult. You know what I'm saying? But here we go. It is 2. Second generation atypical antipsychotic medications are used to treat schizophrenia, bipolar disorder, and other mental disorders. Pyramidal symptoms are an adverse effect of these medications and include restlessness, fidgeting, Parkinsonism, such as tremors, shuffling gait, and tardive dyskinesia, right? So lip smacking or facial grimacing. Okay, so this is where you got to know your pharmacology. Pender. I said 2, Pender. There were 2 2s there, so I just assumed it was 22. So, Pender, hey, I got you. All right? But hey, pharmacology, right? Antipsychotic medications, right? Pharmacology, second largest section on the NCLEX exam, y'all, 14 to 18%. Okay? By the way, I put pharmacological and parenteral therapies inside the 7-day NCLEX course, right? It's about an hour long, 2 videos where I go over 30 questions to include a case study, y'all, because that's what's going to be on your NCLEX. Here we go. Question number 24. The nurse is talking to a staff member who stated, my client has a history of substance use disorder and constantly requests pain meds. I just administered normal saline instead of morphine because it is too early to administer another dose of morphine. Which of the following action should the nurse take next? Report the incident to the facility's ethics committee, follow the facility's protocol for completing an incident report, instruct the staff member to document the incident and notify the unit manager, or instruct the staff member to notify the healthcare provider about the client's uncontrolled pain. What are we thinking? Shout out to all 65 of y'all. We are doing NCLEX questions. These are a lot more in depth. I don't know if y'all can handle the damn case studies anymore. We may not do them anymore. But shout out to everybody that's in here rocking with me. We're doing NCLEX questions. If you guys are new, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, another thing about me, I've been in the Navy for 16 years. I've been on 2 deployments. I've been to 5 countries. 4, that's, what is that? That's 4. That's 449... 444,444,444. That is not the answer, Pender. All right. I'm going to need for you to get it together. Lord have mercy. All right, here we go. Here we go, y'all. Here we go. Here's our answer. Here's our answer in 3, 2. And the answer is just 4, Pender. Just 4. You don't got to be difficult. All right. It's just 4. All right. So administration of a placebo outside of a consent research trial is unethical and deceitful. When faced with an ethical dilemma, the nurse should address the client's behavior prior to reporting or documenting the unethical behavior. Don't do that. Don't do that, right? Somebody be like, hey, I need pain meds. Hey, but they can't get their other dose. Don't do it. And don't try to be like, hey, I'm going to give you normal saline. Don't do that either. Don't do that, right? If anything, hey, let's call the doctor and let's see what the orders say. Hey, I gave it to him 2 hours ago. Can we give it to him early? All right, cool. Can you put the note in there showing that I can give him to her early? You see what I mean? That's what you do, right? This is for, oh, okay, I got you. I got you. I'm tracking. All right. So don't do that. Don't try to give placebos, right? It's unethical. Don't do it. Okay. Here we go. On to the next one. Hey, question number 25. Question number 25. The nurse is caring for assigned clients. The nurse should first assess the client who had a what? All right. So this looks like a management of care. This looks like a management of care question. Okay. Management of care. So who do I see first? Right. Think about it like this. Who's gonna die if I don't see them first? Right. Is it number one, a subdural hematoma 36 hours ago and is requesting breakfast? Is it number two, a transient ischemic attack 2 days ago and is scheduled to receive aspirin? Is it number three, stroke, is receiving TPA therapy and has a GCS score that has changed from 9 to 13? Or is it a bowel resection, is receiving parenteral nutrition and had 4,800 milliliters of urine output over the past 12 hours? What are we thinking? What are we thinking? Shout out to everybody joining me. Hey, 30,000 likes, y'all. If I could get my own self likes, then I would. But I don't think that the algorithm would like that. They'd be like, what the hell? Y'all hear my son out there screaming? I don't know what his issue is. He be trying to come in here and be a co-host and try to do the live. I'm like, what are you doing, my guy? All right, so 444,444. That is incorrect, because that ain't even on here. So shout out to everybody. All right. So what are we thinking? I'm gonna give y'all 10 more seconds. 10 more seconds. Appreciate everybody with their participation. I appreciate everybody rocking on this Friday evening. All right. So here we go. Here we go, y'all. Here we go. Here's our answer in 3, 2. And the answer, of course, is 4, not 444,444. You sillies. All right, here we go. So parenteral nutrition is an IV nutrition solution containing glucose, protein, lipids, vitamin, minerals, and insulin. Clients with gastrointestinal tract dysfunction who are unable to tolerate enteral feeding methods are often prescribed PN. Glucose is a primary component of PN solution. Therefore, the nurse should monitor blood glucose levels and assess for symptoms of hyperglycemia, which has signs and symptoms of what? Polydipsia, polyuria, headaches, blurred vision, right? Severe hyperglycemia can lead to seizures, coma, and death. So shout out to everybody that got that wrong. You said it's either 1 or 4. Well, it's only 4 because that's the answer. So it's all good, though. It's all good. You know what I'm saying? So shout out to everybody that got that question right. Hey, you could see this question again pop up somewhere else, right? But then they could talk about, hey, maybe they have a glucose of, 400. Like, okay, what do we do? And they're on parenteral. Oh, okay, well, that's probably why, right? But then, hey, it increases their glucose, right? But then it also has insulin. So that way you don't have that issue. But you still got to look for it. You still got to look for those, right? To make sure you don't get tricked. But that, ladies and gentlemen, I know that was a long one. That was a long one. But that, ladies and gentlemen, is it for the questions today. It's the GOAT. Davey, hey, you missed it, bro. Like, we just did NCLEX questions, but I had some case studies in here. I had like 500 or 600 people in here, and then the moment I got to case study, they're like, nah, fuck that. I don't want to be a part of that. But anyways, I appreciate everybody coming in here, rocking and participating, everybody that's staying when we do a live again Monday. Hey, if you guys want to know when I do my lives, check it. It's literally plastered all over my page, okay? But Monday, Wednesday, Fridays, 5:30. All right, so Monday will be the next one. I appreciate everybody being here. I didn't have to ban anybody except for some bots because they are out here trying to sell nudes, and I don't like that when you can get them for free. Sillies. Also, I got these questions off nurseslabs.com. I got them off UWorld. I got them off Kaplan. I got them off, what else? I got them off Archer. I got them off Hearst. They're all over the place. All right. So I kind of pulled them together. Also, for the next 48 hours, you guys can get the 7-day NCLEX course for $48. $48. You guys can get it. And you want to know why I did it? I did it for graduation. Somebody came in and I said, they're like, Kevin, I graduated. I'm like, bet, I got something for you. And so I did that. So $48 for the next 48 hours. So you guys go over there, check that out, thebootnurse.com/graduation. Also, hey, you guys can get you guys a free download over there. Also, I do tutoring, coaching, and I have an ebook. You guys can check those out in the links in my bio. All right. And without further ado, what is up? Hey, I'm kind of having a weird hair day right now. Hey, by the way, that's not a fuzz. That's a gray hair. You feel me? Look at that. You see that? Let me show you. Look at this. Ridiculous. Anyways, hey, don't judge me. All right. Don't judge me. Because Jamie probably got it too. You know what I'm saying? Monday, Wednesday, Friday at 5:30. Yep. So Monday, Wednesday, Friday, 5:30. Central Standard Time, Texas time, because that's the only time that matters. But shout out to all 50 y'all in here rocking with me. Hey, if you guys are new here, I'm going to kind of, go over the whole little synopsis about me. Been a nurse for 3.5 years. Failed NCLEX 3 times. I have worked in 3 different ICUs. I have also worked in PACU, and I've also worked in the operating room. I'm going to school right now to get my master's in education. So you have 65 anyway. What you mean? I got 50. What you talking about? Yeah, I've been in the Navy for 16 years. I'm a surgical tech in the Navy. I'm a master instructor in the Navy. I've taught so many different courses, from pre-hospital trauma to trauma nurse course. So I've been doing this. I've been doing this teaching thing for a while, for almost 8 years, and I thoroughly enjoy it. Why not go live Tuesdays, Thursdays? Because I don't want to. So there's that. And plus, that gives me a break. And I tried to do it during the week of Thanksgiving and after that, but I didn't have a lot of people show up. And plus, it allows for me to, be creative and think of some other things to bring to y'all. All right. So no, you're good. You good, Steph. I got you. You good. Savage, you failed 5 times. Hey, look, this is what I'm gonna tell y'all right now. Nobody cares that you failed. Nobody cares. No job will care. No recruiter that's trying to recruit you will care. No one will care. Get out of your own way. So the one thing I'm going to say to you, you failed 5 times. I'm not even going to lie to you. Obviously, you're doing something wrong. So what is it? What is it that you're doing wrong? Have you audited yourself? What's your environment look like? Your support system? How do you study? Do you not understand content? Do you not understand questions? Did you look at your breakdown? Like, do you study ineffectively? Like, were you like me, where you sit on the couch and you on your laptop and you do one question every 5 minutes? You got the TV going on in the background. You're on your phone, on Snapchat or fucking TikTok or whatever. Are you inconsistent? You know what I mean? You overstudy. Okay. So you overstudy, right? But it's just if you overstudy, so now we're talking about a timing and an anxiety type of thing. So if you overstudy, right? And that's another thing. Overstudying could be too many parts, too many different resources. How many resources are you using? You know what I'm saying? Everybody was like, yo, I use this, and this. I'm I'm going to stop you right there, because you're using way too much. All you need is 2. All you need is 2. And that's the thing. What type of review are you using? I have people come in here saying, I swear by UWorld. Okay, I use UWorld and I failed. I used UWorld 3 times and I failed. Now what? They swear by Hearst. I used Hearst and I didn't retain any information. Other people's I used Remar. Well, I didn't really like the way that her stuff was set up. I used Saunders. You can't put a book in front of me. I'll fall asleep. It's not the way that I learn. So eventually I used Kaplan, and Kaplan worked for me. I use Kaplan and I use Mark Klimek. Then I'm going to ask you, what type of learner are you? This is the stuff that I talk about in my coaching. So when the group coaching and stuff happens, this is the stuff that we talk about. Because if I don't know it, you can't know it and you can't apply it. So you need to know it. So that way you can apply it. You see what I'm saying? So are you auditory? Are you kinesthetic? Are you read right? Are you a mixture of both? I liked Archer. You say who said that? Steffi said, I use Archer and always got good scores but failed. I used UWorld 3 times. 3 times. First time it got me saying highly likely to pass and all that other good stuff, failed. Second time, same thing. Third time, same thing. But by the time I got to the 3rd time, it was just me recycling the damn questions. I remember what the questions was, so at that point it wasn't helpful. You know what I mean? So understand. Hold on, let me see. It says I need. What exactly do you need? Do you need to pass? There's a lot of things. Brittany, I just went over all those things. I don't know if I'm a visual learner. Okay. So for Brittany, what you may need is actual videos of showing you how things work, right? Or, somebody doing a PowerPoint lecture or something like that, talking about the things that are pertinent to what you know. But then you also need to know, where is your biggest area that you have problems with, like pharmacology, or is it mother baby or anything like that? So it's just do you know those things? And if you do, you have to apply them. So I'm a learner where I need someone to reel me in and keep it simple. Savage, my man, let me tell you something right now. No one's going to be responsible for you unless you really want them to just be like, hey, bro, what are you doing? And then this is going to be a shameless plug, but that's where my coaching comes in. I've been coaching for the last 3.5 years. Ever since I became a nurse, I've been coaching people on how to pass the NCLEX. You want to know why? Because I don't want people to feel how I felt or feel how you feel. Having somebody you want to know why? Because I had a mentor who literally yanked me aside and told me to my face, in very explicit words that I wasn't doing something right. And I had to fix myself. And I did. And so maybe that's something that you need, somebody to hold you accountable. And that's another thing, accountability, time management. You know, like, do you have it? It says, understand. It says, please answer my question. Pinder, I don't know what your question was. Or answer me my question. Hold on a second. Sir. Hey. What do you want? Okay. I don't know what he's talking about, y'all. I'm sorry. My son's standing at the door, goo and gaga, and so I don't know what's up. It says, I missed the live. Grace, you did. Grace, not only did you miss the live, but I went over case studies. Carly says, I passed my HESI for farm with an 82, now onto OB. That's what I'm talking about, Kari. What app is best for practice? There's a lot of apps that are out there. UWorld has an app. NCLEX Mastery has an app. Like, you know, I don't know if Kaplan does anymore, but UWorld, Archer, they all have different apps that are out there. Like, you can actually, like with the 7-day NCLEX course, you can actually use it. You can actually get the app. The app is Kajabi because that's who the program is through. You can actually download that app and do all the videos, download all the PDFs and all the things that are there that you need from that app. How much do you have to score on UWorld? Steph, I'm going to be flat out. Like, what it's going to tell you is it's going to tell you that, you know, you need to score. It's going to tell you not a specific score, but then it's going to tell you like highly likely to pass, so on and so forth. What I always tell people is that on NCLEX, it's based on a score or a grading scale of 0 to 100. And where you need to be is 50 and above. That's where you need to be. All right. The higher you are above 50, the better, right? The closer that you are to 50 is considered borderline, damn near like I'm not going to make it. Okay. So 50, there you go, Savage. That's exactly what I'm saying. So, you know, that's what I'm saying. But hey, so shout out to everybody that's in here rocking with me. Y'all got me to 24.5 thousand likes. You know, I can't really complain. You know, you guys were super engaging. So it says my score 65 to 70. Pinder, if you're scoring 65 to 70, then, you know, the likelihood of you passing is very high. However, here's what I'm going to say. Are you scoring them legitimately? You see what I'm saying? Like, there are different ways. Like, I was scoring like 71s and stuff like that. But that's because, like, I was studying all wrong. And I was like, oh, I remember what this was, so on and so forth. And so that's why I say, hey, do you study effectively? And I'm not saying that you don't, right? But just make sure, like, you're scoring 65s and 70s. That's great if it's your first time seeing those exams and applying everything that you're learning, right? But then also you got to understand what type of questions are they asking you? Like, you got to understand, like, are they easy questions? Are they easy questions, right? Do those questions require memorization or remembering? Because those aren't passing level questions. Now, when you go above that, such as analyzing an application, applying your critical thinking, and analyzing the question to make a clinical judgment, those are passing level questions. Those are the passing level questions. And anybody can go on to the NCSBN website and you can literally see the diagram that they have, and that's exactly where they get it from, and they explain it, and that's the truth, because you have to get to the goal on NCLEX is that you have to get to the hard questions. You have to get to the hard questions. All right. So, hey, it's 7:00 over here. I'm gonna hang out. I got 36 people in here. What other questions do you guys have? To my man Savage though. 5 times, my guy. Johnny boy, what is up? What is up, sir? If you're looking, hey, if you need somebody to you know, hold you accountable, hey, I do coaching. Like, I do one-on-one coaching where you get this right here. You get this right here, but you get it on a more intense level, and it's more personal, it's private, you know, so on and so forth, where, you know, you get your questions answered, you know, you have contact with me directly, and we lay it all out, you know. And we talk about all kinds of stuff. So I'm just letting you know that if that is available to you, if that is something that you're looking for. Kevin, I'm stressed. I have my final for mental health and med surg next week. Both, huh? Well, here's what I'll tell you. One at a time. One at a time. Remember, with mental health, you got to think about those meds and good therapeutic communication. Good therapeutic communication. I'm thinking because I'm tuned into this. This is the second time. You talking about you tuned into to my lives for a second time? I'm just trying to make sure I understand that. Okay, I'm tracking. Hey, so here's the thing, man. Like, you can go. Hey, by the way, all the lives that I put up, they eventually go up on YouTube. So you guys can go check out my YouTube as well. My YouTube is at the Boot Nurse. Everything is at the Boot Nurse. So you guys can go over there and check that out as well. So yeah, like if you guys go over there and check that out, you guys will see that I've been doing this for, I've been doing TikTok, like these type of little classes, probably since like April. But it really like came to a head probably like August, like around the time school started. So, I like to do these. This is the first time I've done case studies, but you can see how long and how tedious those are. But the participation is key for that. All right. So, but yeah, like I said, I've been coaching for 3 years. I've been an instructor educator for 8 years. It'll actually be 9 years in January. So I've been doing this teaching thing for a little bit. So like I said, anybody, y'all can go check out whatever I got going on up here. Also, there's a free download over there too for y'all, where I talk about, the update for the NCLEX that happened, keywords or trigger words to look out for when you're looking at your questions, lab values, even though you're going to know lab values, but you need to know what happens outside of those, common things that happen, common things you'll see on the NCLEX, common medications, so on and so forth. So make sure you guys can go over there and check that out as well. But what other questions do you guys have? What other questions that you guys have? I actually was going to bring somebody up here today. Like I was going to just pick somebody at random to come on to the live stream or come on to the live right now, just so they can ask their questions. So I think I'm going to start doing that, like maybe every so often, like bringing some people on. If you guys are cool, if you guys are down with that, hey, give me the 25,000 likes. You still didn't answer me. Steph, what you mean? What was your question? What was your question, Steph? And by the way, if I don't see it, it either didn't pop up or it scrolled. Do more case studies. I can do more case studies, right? But case studies are time consuming. They are. Right. But hey, we'll get some more going on. Even if I have to do case studies every so often, at least you're getting them. You know what I mean? So, and it's crazy. I had like 1,400 people that were here on Wednesday. Like, I can only imagine if I would have did this on Wednesday and they were like, whoa. So what are we thinking? What other questions do you guys have? Anybody have any questions about like getting into nursing school, their first job, anything about NCLEX? Like that's what I'm here for. That's what I'm here for. It says do more case studies. I got you. I got you. I got you. All right, let's see what else is going on. See what else is going on. All right. All right. All right. I'm planning on taking NCLEX or taking the NLL PACS entrance. Any tips? The NL, like what is that? Am I slow and I don't know what that is? I'm probably slow and I don't know what that is. But one other thing I did want to show you guys. I'm going to show you guys right now. I'm going to turn my camera around so you guys can see it. So the 7-day NCLEX course, y'all. And Steph, if you're asking me a question, I can't see it. Like either TikTok is blocking it. I don't know what you're saying, so on and so forth, right? So ladies and gentlemen, this is what the inside of the course looks like. I'm going to expand this just a tad so you guys can see. But this is what the inside of the course looks like, right? Once we get in here, look, we talk about computer adaptive test. We talk about the testing standard. We talk about the test plan, which just updated in April. We talk about how to answer NCLEX style questions, critical thinking, the rules on the NCLEX. And check this out. For the 7-day NCLEX review, I got Pharma A. So I'm editing them. I'm editing them as I see fit, right? So the only days that I have up there right now are 2, 3, and 6, right? But then I got the new generation NCLEX review right here, y'all. The new generation NCLEX review, right? And right here, look, I have a whole review where we go through questions and we go through answers. We talk about rationales, like understanding the question, understanding the topic, which is important, right? Let me show you guys something. Let me see if I can find it. Oh, nope, that ain't it. Hold on, I'm gonna show you guys right now. So we'll go here and then we will come. Let's see if I can find it. So like right here where we went over a case study, right? That's exactly what it looks like. How many months do you recommend for a review for NCLEX? So Air Max, it really all just depends. So like if you are somebody who's failed the NCLEX like multiple times, I would say you need to give yourself at least like 30 to 90 days. Now, if you're about to graduate school, you should have already been studying, at least like a month to a month and a half before graduation. Then that'll actually give you another 2 to 3 weeks to study before you get your authorization to test, which would probably equal anywhere to 2 to 2.5 months. Now, I would say no less than 30 days, but no more than 90 days, because by the time you get to 90 days, it's like, what are you really doing? Like, are you really studying? Or are you nervous? Are you getting out, get out of your way when it comes to that, right? So look, new generation NCLEX right here, right? And also look, I have content. Look, for I don't know where is he? Freaking Savage. This one right here is for you, where I talk about NCLEX, like the NCLEX retakers. That's what I call it. So repeat test takers for people that have not done well on the NCLEX. I have a whole 26-minute lecture on talking about how to improve your NCLEX for yourself. Like, I talk about those things on here, right? Talk about how to answer them, answering strategies, so on and so forth. So and then also you get to download the PowerPoint. You get to download the PowerPoint and you get to go and read along with me, right? And so I have tons of content on here, tons of content, right? Right now there's over 60 videos that are in here, 60, right? And then guess what? Right here, y'all, I have 18 videos just in pharmacology. Just pharmacology. Like, we were just talking about psychiatric meds, right? Let's see. We were talking about those psychiatric meds, right? So let's go through them and let's see what pops up, right? There's our intro. Talk about SSRIs, SNRIs, atypical antipsychotics, your MAO inhibitors. Even though MAO inhibitors aren't given out a lot, they still talk about it on NCLEX, believe it or not, right? We talk about the different medications, talk about all of them, right? The adverse effects that you get with them, right? Your nursing considerations, the conclusion. And at the end of them, we do critical thinking, right? And then a lot of them, they have questions at the end. All right. So keyword, like we had to talk about key points to remember, right? When it comes to your medications. This is just one specifically about psychiatric meds. So yeah, these things are super important, y'all. Super important. So that's what the course looks like. Yeah, so that's what the course looks like. It says, who said that? Somebody said something about, is this all on the 7-day course? Yeah, that's all inside the 7-day NCLEX course, and also you get it for a lifetime, number one. Number two, you get all the updates. So any video that I put up there, you get forever. So this is my gift to essentially people that are jumping into it, like right now, until all of my content is put in there, right? And this, like I said, I've had people that have already texted me or I've already messaged me and let me know that they passed with my course, right? It says, how much will it be? So right now, for the next 48 hours, you can get it for $48. You can check that link in my bio. And it's the graduation special for people that graduated this week and that graduate next week, So, but it's open to everybody. I had a bunch of people reach out to me saying, Kevin, thank you for your lives. They've been super helpful. I graduate. I passed my ATI. I passed my SCI. Like, you know what? I think I'm going to do something for that. The link is inside of my bio. It's in my bio. As a matter of fact, I'm just going to do this. I'll put it up here so you guys can see it. Let's see. There it is. So right there where it says thebootnurse.com/graduation. All right. If you want to type that in, you can do that too. Or you can go to the link that's inside of my bio, which is a link tree. Right. Once you click on it, it'll be the very first one that's there. And you can't miss it. So here, we'll do this. TikTok. And I'll show you what exactly it looks like. Right. So we're going to go here. Let's see. We will go to profile. See if it takes me there. View profile. When you view profile, this is what you'll see right here. You'll see that link tree. It said, Linktree / the boot nurse, right? And then this is if you're doing it on the computer, it'll take you to the link tree. And then this is what you'll see, right? So you can get that free download. That's right there. The free download with talking about test taking strategies. I have an ebook that's over there as well. And then I have the 7-day NCLEX course, which is the graduation special. And I'll show you what that looks like right now. So, hey, look. So there's a timer and everything on here. Let's shrink this up. So there's a timer and everything on here, all right? So scroll down, graduation, right? You can scroll through the whole thing, all the other testimonies, everything that comes with it. There's a nice little testimony on here with me where I'm like, yay. Here's the curriculum, all the curriculum that's going to be going in there. Some of that stuff isn't in there, but the most important stuff that's in there right now is the review, right? You get access to the Facebook page as well as, hey, look at that, that's me. When I worked at in a burn ICU, right? some testimonies from people that I helped with coaching, which inadvertently helped create the course, right? And then, of course, there it is right there for $48, and you get it for a lifetime. So you get the on-demand 7-day NCLEX course. You get the new generation NCLEX course, over 100 content videos, which right now there's 60, but once you buy it, it's yours. You get lifetime access to the private Facebook group. You get the content gets updated. And this is for both RNs and LPNs, okay? So when you guys are back over there, this is what you got. Like I said, when you guys click the link, this is what you guys will see, okay? Pender, you are very welcome. All right. So let me turn this camera back around. So what else? Whoopsie. What else? What else are we thinking? What? Oh, crap. I don't know what I did. I just made those bigger, and I did not like that at all. Hold on. All right, there we go. Hey, so shout out to everybody that's in here rocking. Hey, we did NCLEX questions for both RNs and LPNs. All right. RNs and LPNs. All right. So it says Tigers Girl 28. Do you have to be graduating, or can I get it now? Yes, 100%. So the reason why I'm doing it because people are graduating. But you most definitely can go over there and get it as a fresh student. As a matter of fact, I recommend fresh students to get it, because by the time you graduate, it's not going to be $48, and it's not going to be $97. It's actually going to be way more than that. So within a year, less than that, 2 years, it's not going to be $97. So one of the biggest flexes that you can do right now as a nursing student, be like, hey, I got an NCLEX course for $48 or $97 or whatever, right? So, and like I said, everything I just showed that's inside the course, like, you will be able to see, all right? And then, of course, the big thing is watch the videos. I literally had people complain to me. They're just like, this isn't helpful. And then I go into their account and I see that they literally have only watched like one video. And I'm like, you watch one video and it's not helpful? Okay. I make that make sense to me, right? But congratulations once again to everybody that's graduating. And as a matter of fact, for those people that are about to start school, you got through all your prereqs, you got through your entrance exam, and now you're about to start your nursing program. So for all those that are about to start the nursing program, the one thing I will tell you is to get your time management down right now, because the first semester of nursing school will humble you tremendously. It will humble you. All right. So, all right. What other questions do you guys have? Because if you guys don't have any other questions, your boy can get off, and he's about to go get his eat on and wrestle with his son. Put him, he's almost 2, so I'm about to, put him in a headlock. You know what I'm saying? So, is this good for retakers? Yeah, 100%. I don't know, Air Max, if you saw, but I actually just put a video up within the last couple of days called NCLEX Retakers, because I understand this is the reason why I created this program. Literally, is because I failed 3 times, and I never want anybody to feel how I felt. I've already had people come to me and tell me that, hey, your review was super awesome. It was great. It was straight to the point. I understood what you were saying. I rewatched them a bunch of times, and I passed in 85 questions. I'm like, that is wonderful, because that's what I want. I want for you to understand. Like, there's none of this fluff. Like, it's just straight to the point. Content is what you need, right? And breaking down the questions is also what you need. I wish I would have had somebody help me break down the questions when I was in school, or even when I was studying, but I didn't have that. I didn't have that at all. But then we talk about it inside the program. So, like I said, it's great for retesters. Great for retesters. So, what else do we got? Oh, also, I'm doing group coaching, and the group coaching is strictly for the NCLEX. So essentially, think about it as like if you were going to a live review with somebody. Like, I'm going to a live review, like you were going to a Kaplan one or a Hearst one or whatever. But instead of that, you do weekly Zoom calls with me for an hour plus, where it's 10 people, like-minded people, and we go over things all together, right? Who wouldn't want to be a part of something like that for everybody to conquer their exam? You know what I mean? It says, don't show this link in bio. You mean you can't see it? So you have to go to my bio, and you have to click the link that says the link tree. And if you can't see it there, just go to the website, which is thebootnurse.com/graduation. Okay. And as a matter of fact, I can turn this thing back around so you can see it. So anybody can see it if they're interested. Let me see. Yeah. There we go. As a matter of fact, I'll just do this too. There we go. So everybody can see it. All right. So that's where it's at. If the link is not working, just go straight to that link right there. And I don't know why the saturation in the light looks like that. I feel like that red is just really just popping. So, but yeah. And also, like I was talking about, let me see if I can scroll up and I can find it. I think I talked about it already. But yeah, right here, the group coaching, right? Right now I have a wait list and I'm only taking 10 people. I'm only taking 10 people. And I'm telling you right now, this is a fraction of what my one-on-one coaching would cost, right? A lot of people are just like, I can't afford your one-on-one coaching. And I'm just like, cool, I got something that's coming out. And if you want to be a part of that, it's going to be a fraction of what that costs. Because my one-on-one coaching costs $1,400, right? Or I'm sorry, it costs $1,500, right? And so for a fraction at $397, you get me in a group of like-minded people where I guide you guys on strategies on how to conquer the NCLEX exam. It doesn't matter if you've taken it, if you haven't taken it at all, or if you failed the NCLEX 10 times. I'm telling you right now, I have coached people one-on-one who have literally graduated school, took the NCLEX in 2 weeks, have passed, as well as those who have failed the NCLEX 5, 6, 7 times. 5, 6, or 7 times, and then they pass the next time. All right. So you got to remember, when it comes to the NCLEX, it starts with you. Like, it starts with you. You have to have a mindset. You have to have the mindset to want to conquer, right? You can't blame nobody else for anything else that's going on. You have to realize where you have the issue. All right. And then you have to improve upon it. All right. So there's that website. I'm going to turn this camera back around because it looks kind of weird. And like people jumping in here and be like, oh, my God, what is that? So your baby crying. Why? He always crying about something. He's 2. So he's at the terrible 2 stage. You walk out the room. He cries. He slips and falls. He cries. You take something away from him. He cries. He's frustrated when he can't open something. He cries. He just cries. He's just a cry baby. Nah, he's cool. He's cool out there. So he's always crying, Pender. Trust and believe. But hey, what other question? Hey, I'm going to hang out here for another few minutes answering you guys' question. I would try to bring somebody on, but to try to answer their questions. So see what's going on. But as a matter of fact, yeah, I think I can. We'll do that. We'll see. Who wants to jump on? Who wants to jump on live with me real quick? And I can answer their question. Hopefully give you something, give you something actionable that you can take and do. All right. Because that's what it's about. You have to take action. You have to take action. All right. Like, you have to take action. If you don't take action in anything at all, it doesn't necessarily have to be about this, but if you don't take action in anything, how do you expect to get the results? How do you expect to get the results? All right. So it says, Jose, it says, what do you recommend for somebody that's graduating nursing school this next semester? Do you mean like, what do you mean? Like in the fall, in the spring? Is that what you mean, Jose? If that's what you mean, you should have just said the spring. I don't know why you said this next semester. I feel like you made that more difficult than it had to be, my guy. It's okay. But okay, so in the spring of 24. It says, what do you recommend for someone that's graduating? So what exactly do you mean? The link pay $51 for only 7. So Pender, it's 7 days, but no, you don't have it for 7 days. The title of it is just the 7-day NCLEX course, right? But you have it for a lifetime. That's what it says. All right. So you have it for a lifetime. But like I was telling you earlier, the whole point of it being 7 days is because there are tons of reviews out there that do what they call crash courses over the span of 3 days. But I got a headache when I did those. So I was just like, you know what if I spread it over 7 days? Like, you give me like an hour to 3 hours of your time each day, and we go over questions and answers, talking about those important sections on the NCLEX, like management of care, right? Pharmacological and parenteral therapies, physiological adaptation, basic care and comfort, health and promotions, right? What's up, Miss Al? You missed it. I had at one point, I think I had like 600 people in here, but on average, I think we were floating around like 60 or 70, which is still a great day. So But yeah, Pender, that's what that means. You don't only get it for 7 days. It is on demand. You have it forever. You have it until you can give it to your descendants. As long as they know your email and your password, right? But back to Jose. If you're talking about like for an NCLEX course, first one I'm always going to recommend is mine, which is linked in my bio. So you got to click my name and then you got to go there and then it's right there at the bottom. It's in a link tree. And right now it's going for $48. $48 and there's 60 videos in there. 60. But it's only like that for this weekend. It's a graduation special for those, shout out to those that are graduating, So, and also you need to make sure you have some good Q&A, some good, you gotta time management, understanding where your weak areas are for NCLEX. So like, is it farm? Is it farm? Is it management of care? Is it peds? Is it psych? Like you really got to hone in on those areas. Like that's where I would say start first. So yeah, time management is a big one. Time management is a big one. Stain gal, I saw you creep up in here, right? And there go Brish. I see you out there. But yeah, I'm going to hang out for another 5 minutes. What other questions do you guys have? What other questions do you guys have? All right. Let's see. I was going to bring somebody up, but I guess nobody wants to come and hang out with me on the live. So I guess I'll just do it on Monday. I'll bring somebody up on Monday. But yeah. So also make sure you guys go over there and check me out on, Instagram as well as YouTube. These lives will end up on YouTube at some point. All right. And they're super helpful. If they're helpful for you, cool. If they're not, also cool. Let me know, because I love the constructive feedback in order to make these lives more, more productive and constructive for the people that need them. All right. So what else are we thinking? All right. Hey, by the way, I had somebody come into my DMs and they were telling me that they failed their last semester of nursing school. Like they didn't fail the semester. They just didn't pass the exit. Right. So the next thing I'm going to say to you is, all right, cool. It says, hello, I have not been in class for a long time. Everyone is well. Miss Joanne, how are you? Everything is well. Which city you belong? That is such, Pender, where are you from? Because now I'm curious. I want to know where you're from before I answer my question. Miss Joanne, everything, hey, we're good over here. I appreciate you. I was actually talking to somebody about you not too long ago. So, but yeah, I had somebody come into my DMs and tell me that they failed. And I'm just like, I'm sorry to hear that you failed. And I was just like, what was the issue? There's like, I don't know. You're from, was it Calgary? That's Canada, right? Calgary's in Canada. I know someone else is from Calgary. I think Joanne's from Calgary. Yeah, that's what I thought. Okay. So you're Canadian. All right. So I'll let it slide. I live in Texas. So here in these United States. What was the talk, Kevin? Yes, I'm encouraged. Finished my last semester and your videos have been super helpful. Thank you. You are very welcome. Is it Candace? Candace, you are very, very welcome. Hey, Candace, just in case you didn't know, the 7-day NCLEX course is going for $48 right now. Just make sure you go over there and check that out. But yeah, so like she failed and I was just like, all right, cool. I understand that. Hey, but you get 24 hours. You get 24 hours to feel sorry for yourself, because by hour 25, you better figure out what you did wrong. That way you can go and you can conquer, right? What is it that you didn't understand? Did you not understand the question, right? Is it the content that you have a deficit on? You know what I mean? She can't start school she can't go back to school, until May. So she has a whole semester to figure it out, right? So always figure it out. Hey, remember, if you are unsuccessful at an exam, or if you're unsuccessful at the NCLEX exam itself, hey, remember, you are delayed. You are never denied. Delayed, never denied. All right. I need for y'all to sink that inside of y'all's head. But Joanne, back to you. I pretty much just told somebody, I was just like, if it wasn't for you, I wouldn't have known that there was an issue going on with my website. And you were so persistent on wanting to look at everything that you told. And if it wasn't for you telling me that, like, who knows on how many people would have missed out on the opportunity to grab the review. So that's what we were talking about. I was just like, she's an angel. So, but shout out to, hey, y'all got me to 25,000 likes. But yeah, so that's what I'm gonna tell you guys. Hey, stay persistent. right? Get out of your own way and put in the work. You really, 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 really got to put in the work. All right. So what else y'all got? It says, "Oh yeah, I'm diagnosed with attention to detail, action. I got you, and I appreciate that because you're like, hey, look. Hey, if you're persistent and you want it, yes, ma'am, you're gonna get it. That's a. Everybody take a number from Joanne. Hey, action takers. Action takers are the real winners. All right. What's up, Tay? Tay, you just got here and I'm about to get off. You missed it. We did NCLEX questions, case studies, all that good stuff. You missed it. I passed my first semester of nursing school. Yes, Lord, that's what I'm talking about. Congratulations to you. Hey, one semester down, a good many to go. All right. So since you passed, hey, enjoy your holidays. Oh, I know you've been busy. I know you. Hey, trust me, I know the finals. They take your focus as they should. All right. So 2 semesters to go. There you go. Before you know it, you're going to be walking across that stage with a degree or, a fake degree, and then they send you a real degree in the mail. And then you'll be sitting for that exam. So congratulations to you knocking out your first semester. All right. But all right, ladies and gentlemen, that is my time. I appreciate everybody that came through. Another little shameless plug. Check out all of my links that are in my bio. 7-day NCLEX course right now going for $48 for the weekend. So shout out to everybody for graduation and stuff like that. Also, there's a freebie. You guys can go over there and check that out. Also, if you guys have any questions, like within crazy reason, I'll reach back out to you via DMs. Al, you have a good night too. I'll probably see you later on another live. So also check me out on YouTube and check out my Instagram. Everything is at the Boot Nurse. But be great, kind to yourself. Have a great and safe weekend. And then until then, I will see everybody on Monday, 5:30 Central Standard Time. Because y'all already know we're going to rock these questions. So, peace.